When it comes to stimulating the economy, getting people into their first home, it's its best level in 11 years. And we've ensured that people have been able to save better for their deposit with the first home loan deposit scheme, save better under the first home super saver scheme, and then be backed into building their own house with those grants. But as I say, we put 25 down, they put the 350 down or 300 down. Labor's plan is just to spend the lot themselves and put it on the taxpayer. And state governments have responsibilities here, and we support them to do that through the National Housing Finance Investment Corporation. And that was an initiative that I pulled together with the state and territory treasurers to enable that. It was a great piece of cooperation and partnership, and I think it's making a really big difference.
Is it, as David Wilsprout said this morning, good enough that just 999 people living in disability accommodation have been vaccinated?
No, we've got to step up the performance there. There's no doubt about that, and I'm working with our health officials to achieve that. I'm very pleased that on aged care facilities that we are about just over 85%, particularly by the end of today. We get the numbers will be over 85% of first doses in aged care facilities, which is on track. I think that's very important, and we welcome that. We are really starting to see the daily, on a weekday, the doses that are being delivered by principally the Commonwealth Government through the GPs and through the in-reach services into whether it's aged care or other facilities. That's really starting to pick up pace, and we welcome that, and we welcome the support of the states and territories in doing their bit as well.
He's also suggested there has been no coronavirus cases in disability accommodation facilities. Is that correct?
That's my understanding. That's my understanding. Going through the COVID pandemic, and particularly when we went through the second wave in Victoria, that was an area of deep concern for us. And in the area of disabilities, Australia has actually performed extremely well in preventing the virus impacting on those communities. And that's welcome, but we can't be complacent about it, and that's why we do need to do more and do better when it comes in ensuring that we're getting the vaccination levels up in our disabled community. And I'll be working closely with Linda Reynolds, of course, and Greg Hunt to ensure we achieve that.
Last question.
They are part of phase 1A of the rollout. When do you expect that to be completed?
As soon as possible. It's always been our view that we wanted to move through these priority populations. Professor Murphy has said sort of mid-year, and so we're working towards that. And as I said, on the aged care population, we're over 85% now, and so that has been the population which was most at risk. We saw that, you know, when the contact tracing failed in Victoria, and we saw the second wave just wreak havoc in that state. And we saw the hundreds of lives lost there in Victoria, and they were the most elderly and the most vulnerable, and that's why we've made aged care such a high priority.